hand, use the raise your hand function, and we will spot you and have you unmute yourself so you can ask a question, or you can always put it into the chat. And then we're going to have some of our panelists field those questions. We have Dr. Hamill, Dr. Carter, and Dr. McKean, who are able to adequately describe what it's like at their specific hospitals that they work at, what things they do, what things they see, some good points of it, maybe some weaknesses of the program as well, kind of get you guys involved and see what's what. So with that, I'm just going to say, let's open it up to questions. If whoever's got something, well, actually, let's do this. Dr. Hamill, why don't you introduce yourself, your program, take a couple of minutes, and then we'll have Dr. Carter and McKean do the same.
Sure. Hi, everyone. My name is Lauren Hamill. I am a CA1, so I'm a second year at UPMC Pinnacle Lidditz here in a lovely Lidditz, PA, where it's probably about 78 degrees outside today. I'm inside right now, but I'm looking outside. It's really nice. But anyway, we're about 15 miles north of Lancaster, PA. If you're not really familiar with that, we're just a little bit south of Harrisburg, Pennsylvania, right in the middle of the state. In terms of our program, we're a pretty small program. We have 8 residents this year. We are expanding next year. We just matched 3 residents, so we're going to be having a total of 9 residents next year. So that will be 2 CA3s, 2 CA2s, 2 CA1s, and then 3 interns. What else about my program? So we're really, like I said, we're really small. We have a small hospital out here, UPMC Lidditz, where we do most of our rotations. And we also do rotations at Penn State Hershey, as well as UPMC Pinnacle in Harrisburg. Because we are affiliated with UPMC, we do have the option to get rotations pretty much at any UPMC facility as well. So if that is something that you're interested in, you just have to kind of like discuss it with our program director and our coordinator. What else? Is that good enough, or is there something else I could maybe?
No, that's fantastic.
Okay.
Yeah. Dr. McKean, tell us about Columbus.
Yeah, sure. So for everybody out there, thanks for joining us. I'm George McKean. I'm the program director at Doctors Hospital, Ohio Health in Columbus, Ohio. Thankfully, we have Dr. John Carter with us as well. He's a CA2. But kind of, yeah, I mean, I'm sure you guys all somewhat familiar maybe with Columbus, Ohio, familiar with Ohio State University, which is nearby. Thankfully, we do have some interaction with the residents at Ohio State as well. We sometimes rotate with them at Nationwide Children's Hospital, maybe at Grant Medical Center as well. But specifically for Doctors Hospital, which is located, like I said, in Columbus, Ohio. We're a medium-sized community hospital. We currently take 2 residents per year. We're a former AOA program, recently merged with the ACGME. And so we have our initial accreditation. We're going to be having a site visit coming up shortly, and hopefully we'll have final accreditation. We just did match 2 residents this year, so we take 2 per year as of right now, so a total of 8 residents. And the plan is to be matching 3 or possibly even 4 going forward after that. We don't have finalization on that as of yet, but that's hopefully the plan. I don't know if any of you guys know, but for ACGME, for anesthesia residency, you are required to match at least a minimum 3 per year. So we should be going to that shortly here. But anyway, for the time's sake, we take 2 per year. Everything's been going great with the merger. Like I said, we have the final accreditation coming up here shortly. In addition to that, we have osteopathic recognition, which is something that pretty much only about a handful of programs in the country really even have anesthesia programs. As you can imagine, mostly the former AOA programs that are still up and running and now have merged with the ACGME. So we do have that as well, osteopathic recognition. And then, like I kind of mentioned before, thankfully our residents, we get great opportunities within Columbus, is we get to rotate with Grant Medical Center, which is a level 1 trauma center just right down the road. We have affiliation with Nationwide Children's Hospital, like I said, which is a great tertiary care center. It's a huge children's hospital. And we have great opportunities for pediatric fellowship is there as well. Currently, one of our chief residents, he actually matched into the pediatric fellowship at Nationwide Children's. And then Dr. Davenport with us, he matched into a fellowship. He was one of our former residents, graduated the program. He was my chief at one point, and he did a pain fellowship out there. And so as I've been there ways at Doctor's Hospital, I've gone through. I was a former resident myself, and then I graduated about almost 5 years ago now, and now I've been the program director for a couple of years. It's been a great place as a learning environment, training facility, and I'm really happy and proud of our facility, and I'm happy to be program director. And then kind of one final note is I feel like our medical education department is fantastic. They have a lot of great resources. We have a state-of-the-art sim lab, provides a lot of training opportunities. And yeah, Dr. Carter, if I miss anything, Dr. Carter can fill in for you guys anything else I miss. I appreciate it. Thank you.
You covered it quite well.
Perfect. Dr. Carter, if you don't got much to add, we can just open it up to some questions. And then we'll kind of, pick going back and forth who wants to answer them and based on their different regions. So feel free to use the clap emoji to raise your hand and we'll call on you. You can just tell us the question, or if you want to use the chat function, that's fine as well. So one question I have, and we'll start with Dr. Hamill. At your facility, is it just anesthesiologists and residents, or are there CRNAs? Is there interactions if there are CRNAs?
Yes, so we have both. We have anesthesiologists, full-time anesthesiologists, as well as CRNAs, and we do interact with all of them. And overall, the relationship is a very good working relationship. You can, as residents, we have first pick on cases, based on, our level, and, where we're at in the program. And the CRNAs are totally okay with that. And they welcome, us and, definitely help us with our training. They give us breaks, we give them breaks. It's a good working environment that we have with them.
Perfect. So I just got word Dr. Elder is here. Dr. Elder, if you wouldn't mind giving us a brief overview of your facility, the city, something like that.
Yeah. Forgive me. Sorry about being late. I couldn't get it to work on my computer, and I can't get the video to work on my phone. Am I coming through okay?
You sure are.
Okay. So my name's Dylan Elder. I'm one of the residents of South Point Cleveland Clinic, right outside of Cleveland, Ohio. And if I don't give anything that y'all are looking for, let me know, please. But we take 3 students per year. That will become residents. Intern year is just traditional intern year, rotating through your basic stuff. We do three months of anesthesia though. And then CA 1, 2, and 3 are pretty much following the ACGME guidelines set forth. About us, we're a small program, but we do have the opportunity to rotate at main campus, Cleveland Clinic. We go to Akron's Children as well. And we go to a few other regional hospitals that are fairly big in comparison to South Point. Case ranges, typically for us at South Point when we're here, is your basic bread and butter cases. Occasionally you'll get some thoracic here as well. At main campus, we do cardiac, peds. We don't have peds here, but I think they're trying to get that. So you'll get some small peds cases here. Anything else that I can tell you about?
No, but since as you're joining in, we just asked Dr. Hamill, are there CRNAs at your facility? If so, what's the interaction like?
Okay, yeah, so our program, we do have CRNAs, but we rely heavily on residents as well. I wouldn't say like we're resident run, but our residents do quite a bit of the work. We do get to pick our cases over CRNAs if that's ever a concern for people. You do cases that correspond to your training level for the most part. So you're not going to be putting anything that you're uncomfortable with at any time. Any other questions?
No, that's perfect. Dr. Carter, same question from the resident perspective there at Doctor's Hospital. Are there CRNAs, and if so, how does that work?
Yes,
And then we'll get to
we also have CRNAs at our program. It's a very friendly relationship with them. We typically are in our own rooms. However, we do break CRNAs and whatnot. We primarily also cover OB. That's typically through residents. In terms of picking cases, we have first priority as well. And if there's any additional lines or advanced airway, awake intubations that need to be done, it gets brought up to residents for priority. But overall, it's a pretty friendly environment.
Perfect. Amanda, I'm going to ask you to unmute yourself, and there you go.
Amanda, I don't think we're hearing you.
I definitely don't hear her.
Yep. Amanda, if you want to type your question into the chat, because I think there's an issue with your audio, then we can take your question from the chat. Thank you.
While she's typing it into the chat, Dr. McKean, as a program director, this is a good question for you. This comes from Alexander. How are you dealing with the changes to step one coming with the pass-fail criteria as opposed to a score?
Yeah, I guess it's kind of difficult. It's not that the step one score is going to be the end all be all, obviously. It was, thankfully, last year we still had that to utilize, and because we didn't have as many rotators due to COVID. But really, I feel like during, a 2-week rotation, you get to know somebody pretty well when you're working with them every day. So that carries a lot of weight, just kind of your presence during the rotation, asking questions, things like that, see how you work with everybody. Obviously the interview itself is a big factor. And then, letters of recommendation, personal statements, your extracurriculars, leadership, scholarly activity, all that kind of stuff plays a big part. But yeah, no, it will be tough because it's not that we would probably at the end when we're like looking at candidates, using the USMLE or COMLEX scores, probably not the huge factor. It's probably more when you get hundreds of applications, it's kind of an easy way to kind of weed through who you really want to look at as a interview candidate. So that's going to be tough. And then the other part of that is grades as well. They're not really, a lot of med schools out there aren't really doing grades anymore. We're going more towards pass fail as well. So we'll have to, it's probably going to be more of a factor of just your personal rotation you do. I feel bad for some, actually it's probably tougher as DOs who are looking for allopathic residencies. It might be more difficult because the USMLE score was kind of a way to level the playing field, and now they don't have that opportunity anymore. I'm personally not a fan of it. I don't know who really made that decision, but maybe one day they'll go back to having scores again. They might see that there might be unexpected consequences of this, and down the road might change it back. But another option I was kind of been thinking about recently is actually, students who come rotate with us, maybe giving a small little test at the end of the rotation, just to kind of see how people do, the knowledge they pick up, things like that. Because, I do want to reward people who work hard, who put in the extra effort, who really, study, read, all that kind of stuff. And but yeah, it'll be a challenge, but it's something that we'll just have to get through.
Makes sense. I know when I rotated through, there was one program that did do a test at the end of the rotation.
Yeah.
All right. Good question for somebody else. Let's see, Amanda. This is what Amanda's question was. Caseload distribution between cardiac transplant, peds, orthopedics, and then if COVID has affected any program significantly, and if how. So, Dr. Elder, what would you say kind of your general breakdown is amongst those, the bread and butter stuff versus the more advanced loads? And then we'll have Dr. Carter, Dr. Hamill answer the same.
Yeah, so the choices were bread and butter, cardiac, and I'm sorry, what else?
Like cardiac, peds, ortho, She mentioned transplant specifically, which I never did any.
Okay. Yeah. So that's a good question. So if like I said here at South Point, they're trying to get, there's talk, I'm not gonna say they're trying, there's talk about possibly getting basic peds back here. But as far as your peds procedure, you'll do that all at Atkins Children, which is like a level 1 trauma center, tertiary care place. So you'll get 2 months there. And if you want more, you can obviously do another month there. So you'll get your peds there. Cardiac, we do all cardiac at downtown. So Cleveland Clinic, like main campus, one of the best places for hearts in the world. You'll get such good exposure there. Cases that you'll probably never see again outside of residency. As far as your bread and butter cases in ortho, we do a lot of ortho here at South Point with our ortho program. There's always an ortho room going, and here at South Point, and which is a little different from most places that when I interviewed at, most places I interviewed at had a month of ortho, a month of vascular, a month of this, a month of that. At South Point, it's kind of every day is different. You're not doing a case for a month straight, the same type of case for a month straight, I guess I should say. It's just a revolving door of cases and variety that you'll do here on a daily basis. If there's anything that you need further explained, I'd be glad to help you with that too.
No, that's pretty good. Dr. Hamill, same question to you, kind of specialty rotations versus bread and butter.
Yeah, sure. So we sort of similar to what Dr. Elder said, but in an obviously different location. We do our bread and butter stuff mostly at UPMC Lidditz, which is our main campus here. Your general run-of-the-mill stuff, your general surgery, your ortho, plastics, gyn-onc, OB, things like that. But then the more specialized things that I believe it was Amanda that was mentioning, like cardio, neuro, peds. Peds we do up at Hershey, Penn State Hershey. We also do neuro as well up there and trauma at Hershey as well. And then hearts we do at UPMC Pinnacle Harrisburg. We are looking to expand to do more cases up there because we don't have peds right now at our hospital anymore. We had a lot of peds ENT that unfortunately went away. But we do get really good peds experience, like I mentioned, up at Hershey, and that starts with your CA1 year. You get to go up there and start doing peds up there, and then you repeat that for the rest of your time, and you can continue to do if it's something you want to pursue as a fellowship option or something like that. You can talk to our program director or anybody like that to schedule more. But it's just right now it's just 1 month every year. So that's pretty much it for the specialized ones.
Perfect. So that's all relatively close. You're not having to travel significantly away for those rotations.
Yeah. From my apartment to Hershey, it's about 25 to 30 minutes. And then from my apartment to Harrisburg, it's 35, 40 minutes.
So you're still in town. I know some other programs, I believe you're leaving the city to go to a different state for some specialized rotation, but you're local. Dr. Carter?
All right, so for our rotations, it sounds fairly similar at our base hospital, doctor's hospital. We do a lot of the bread and butter stuff. We do a lot of ortho, so we get good experience with regional, doing lots of blocks. We also do the general surgery cases, vascular and whatnot. OB, we do OB coverage, both in the OR and for C-sections and epidurals. In terms of the specialty stuff, starting our CA2 year, we do 2 months at Nationwide Children's, pretty big hospital in Ohio. Get to see a lot of exposure to different sorts of pediatric cases. And they do have a fellowship program, which Dr. McKean said one of our residents matched into for fellowship. Additionally, for hearts, we go over to Mount Carmel, Grove City, 15 minutes away from Doctor's Hospital, and we get to see a lot of the thoracic cases and cardiac cases over there. Outside of that, with neuro anesthesia, we do those primarily at Grant Medical Center, level 1 trauma. They do a lot of the crannies, mass removal there. So we get to see quite a bit there as well. We also do some trauma anesthesia there. And I believe that covers a bit. We don't do any transplants. However, every once in a while we do organ procedures. So.
Perfect. Dr. McKean, one question that's been kind of common in the chat, and you're program director, so you probably got the best way to figure this out. People are setting up their audition rotations right now. Some of the questions are concerning what's a good way for us to stand out, any recommendations for us while we're on interview, how can our application, be better, more visible for you guys to pick out and see. Any thoughts on that, Dr. McKean?
Yeah, sure. I guess, for one, while you're on your actual rotation, it's probably always good to, make sure you're showing initiative and showing that you're there to help in any way possible. And you don't just kind of go hide in the corner and wait for somebody to come point to you and, hey, come do this. You want to, stand out and really show that you're looking to do anything you can to help. Sometimes whether it's even just holding a patient's hand and then, helping to move a patient, transport a patient, things like that. But obviously when any med student comes and rotates with us, we really make sure they can do all the, procedures they're looking for, obviously intubations, airway, mass ventilation, LMA placements, all those kind of things. Sometimes we notice sometimes the med students maybe just jump in, especially with some with the CRNA, sometimes they just kind of pop in a room right when induction's about to happen. And they don't really introduce themselves. They just say, hey, I'm here to do the airway kind of thing. And that's usually kind of looked down upon. So you always want to make sure you introduce yourself, make sure everybody kind of knows who you are, what you're there to do. You're there to help out anyway. And you're looking to do some airways, and also obviously looking to learn as much as you can about anesthesia. So that's usually a big thing there. The other thing I would say is I would say as soon as you can, if you don't already, get either Morgan McHale or Baby Miller, like the review textbooks, and just start from chapter 1, try to make your way through those books as much as possible. Particularly Morgan McHale is usually really good. That's what we use more often. Maybe the first 20, 25 chapters or so, that is really excellent. If you can get through as much as that as you can. And then you can really look to answer those questions as they get asked to you along the way. And obviously we all understand, your med students, your first focus is not, learning and retaining anesthesia information. It's obviously getting through med school, all the general information in that regard, and graduating medical school. So it's not like you're expected to know everything, all that kind of stuff. So, but yeah, being able to speak intelligently in regard to some anesthesia topics. In our didactics, we kind of have a question answer format where we go through around the room. Whoever's kind of presenting didactics for the day usually asks questions of their fellow residents and also the maybe off-service interns in the room, and then the med students who are rotating as well. So obviously, and we post those chapters ahead of time, so you kind of know what to look for in advance, what to read, and then so you're able to answer some of those questions on the day of the didactics. So yeah, I would say, reading anesthesia, showing initiative, being as helpful as you can. All those are kind of great ways to stand out during your audition rotation. And then, if you don't get the opportunity to audition at a program, you'll still, have a great ample opportunity to go through the interview process. Really ways to make your application kind of stand out, I would say, is probably doing research is one of the big things we're looking at. And it doesn't have to be specifically, that was one of the questions that were asked. It doesn't have to be anesthesia research per se, but, really any kind of research you're showing you're, curious towards child activity, and you want to, kind of bolster your resume that way, and showing that you're, you kind of have some background knowledge on how to go through the research process, so that information will come in handy for you during residency. I'm trying to think if we just went through the match process, and we just matched our 2 residents this year. I don't believe either one actually rotated with us. And I'm trying to look back. Over the years, we kind of have a nice balance. Some students who match at our program have rotated with us in the past, and some don't. Me personally, when I came through, I never rotated at Doctor's Hospital, and I matched there. So it's not like you have to rotate there to match. So yeah, just having some good research, some good volunteer work, that kind of stuff, and then and during the interview, it's more you just got to be yourself. Answer the questions the best you can, that kind of stuff. And that's having the research and volunteer work in your background gives you a lot of great things to kind of talk about during the interview process. So hopefully that was helpful.
But if I add in a couple more things.
Oh yeah, sure, yeah, of course,
Yeah, I'd say since you guys are all students, if you're doing audition rotations, when you're in the OR, one thing that was told to me is always have gloves in your scrubs pocket. So if you get asked if you want to try an airway, don't take extra time, find gloves, all of that. I think when we had students rotating through, what I'd always do is I'd make sure they're really invested in their own education at this point, because, if you're auditioning for anesthesia, you should be interested in the topic. So typically I would have students pick out a topic, research about it a little bit, and, talking about it. So every day kind of keep up with some reading, come up with more questions about the OR and what's going on, what to look for. And when you're actually in the OR, be very conscious of what you're doing. Don't touch sterile fields. If the patient's really having a difficult time, don't ask a bunch of questions to the resident or the attending. Kind of find out when things are appropriate to, chat about things when there's kind of a smooth sailing portion. We also have that, really investing in your own education and having enthusiasm doing it. And also at this point, a lot of students, they want to come in and do an airway. It's really cool to do an airway as a medical student, but kind of transitioning into focusing on what you'll be doing. You want to get as much experience as possible, but at the same time, you want to see some cases all the way through, see some of the difficulties with intubation or signs for waking up patient and what to look for. So it's not just all procedural at this point.
Fantastic. I'm gonna get to Brandon. He's got a question. So there you go, Brandon. Go at it.
Hey guys, I'm Brandon Vowles. I'm a first year at LECOM in Bradenton, Florida. Yeah, my question, you guys kind of answered a little bit, but I was just wondering what you guys think would be the best thing I could do this summer as a first year to strengthen my application for anesthesiology, especially now since for my class, step 1 is pass fail. So I'm trying to be as much productive as I can this first summer.
Probably a good question for Dr. McKean.
I was trying to answer some of these questions here on the chat, but yeah, I guess, probably the biggest answer is going to be any form of research you can get involved with, from my standpoint. And then second, probably on that list is going to be volunteer work, just really showing those extracurriculars. Like I said before, yeah, research and volunteer work that you can do. I know a lot of times some of the programs can offer some fellowships in between the summer of between first year and second year. Thinking back, when I was in med school, I did an anatomy fellowship in between first and second year. So I don't know if your school offers anything like that, but things like that you can get involved with. But yeah, I would say if you can start getting involved in any kind of research, that's probably your best thing you can do. Because yeah, in between first and second, I don't know how many specific things you can do for anesthesia per se. If you can always, go, it's not like you can do I don't think you can do a rotation during that time, but if you can go and shadow an anesthesiologist, if you can find somebody like that, get somebody who would potentially provide a letter of recommendation down the road, who you can build some rapport with, that'd be great as well, I think.
Thank you.
Fantastic. Thanks, Dr. McKean. Ursula, I'm going to have you unmute yourself.
Yes. Hi, everyone. I recognize some of the faces here. I'm an anesthesiologist at Stony Brook. I'm also on the Board of Governors with the AOCA. And I run a lot of the anesthesia interest groups at the NYIT COM and also at Stony Brook. And one of the things I recommend students to do is, it might be now for those of you looking for something this summer, is to get involved if you wanted to do research with fair.org. You can do, actually it's a paid, it's a match, and you can do research and you get paid for it, and you can go anywhere in the United States. There's actually quite a few. Stony Brook used to be part of it, and I used to run it for our department. but we're no longer on it, but you guys can definitely apply to it. So that's something good if you want to do, for those of you who will be between like MS2, MS3 year, MS3, even MS4, you can fit it in as like a rotation even. Sorry, I have like weird things in my background. Sorry, I'm looking at my background, trying to get this work here. But yeah, if you guys have any comments on it or questions, you could feel free to message me also. Everything that everyone said was really, really good advice. You know, and how to stand out. That's like one of the lectures I give, is how to stand out on your clinical rotations. And I usually do that to spotlight that for the medical students. So you're welcome to message me too if you have any direct questions. Also, what you might want to do is get involved in shadowing. I know some places will do that, and maybe the doctors at the hospitals here offer that too. We do that at Stony Brook, and I run the shadowing program, and you guys are welcome to message me regarding that also. If you happen to be in New York or on Long Island, you're welcome to do that for whenever you're free. So that's all I just wanted to add, but it's so nice to see all of you here, and looks like a great amount of interest in anesthesiology. So that is awesome. Enjoy the meeting too if you get to attend it.
Thank you for that. That was helpful. We had one other question. This will be good for Dr. Elder, and then Dr. Carter can answer this as well. Talking about progression of anesthesia cases. Specifically, the question from Christopher was, I realize you're not running cases for which you aren't comfortable, but is there a standard progression through the types of cases you will be running as you move throughout residency? So Dr. Dylan Elder, and then we'll have Dr. Carter.
Yeah, sure. So as like a standard progression is like you do this case and you do this case and you do this case. No. What I meant by that is if you're a CA1 and you're in your second month, you're not going to be doing like a carotid endarterectomy. You're going to start, slow and work your way up. You're not going to be doing VATS your CA1 year. Basically what I meant is you're not going to be tasked with like an ASA 4 or an ASA 5, like your very first month. It's just a slow building process, just like it is with anything. If you're looking for more of a specific answer, I'd be more than happy to elaborate more.
Dr. Carter?
So I guess in terms of that, there's no no real progression in terms of like Dr. Elder was saying, like you do this sort of case and you do this sort of case. Typically when you start off as an intern or a CA1, the cases you'll see are usually more in the beginning anyways, like your healthy ortho cases, maybe some urology, and your attendings will be there whenever needed. It'll never be set up to fail. So even if you have difficult cases and it's a little out of your comfort zone, your attendings will still be available to you at very key portions of these procedures. So I guess as Dr. Elder was also alluding to, when you're just starting off, you're not going to see like the ruptured AAA or the head bleed or crazy traumas, because you're still trying to find your way around the OR and kind of get in the normal routine. So it's one of the benefits of going to kind of a smaller program is that your attendings will really get to work with you a lot more, and they find where your comfort zone is and kind of how you progress. And it's up to their discretion on kind of allowing you to work on much more challenging cases. So hopefully that answers the question.
Fantastic. I got a question for the panel. So we'll start first of all with Dr. Hamill, and then we'll ask Dr. Carter and Dr. Elder as well. Moonlighting opportunities. Are there moonlighting opportunities at all, or is it no, our program will never let you moonlight?
At this time, we are not allowed to moonlight. So we are.
Is that a COVID thing?
I'm sorry?
Is that a COVID thing?
No, it's just a policy that we have for right now. It is a a fluid kind of a thing that, may or may not change in the next couple of years. But right now, we are not allowed to moonlight.
Dr. Elder?
So we can moonlight after, oh goodness. I don't do it. I have a family, so I like to see them, but what is it? I think after a portion of your CA1, you're allowed to moonlight. However, we don't have anesthesia moonlighting opportunities. You can basically go to like urgent cares and moonlight through there, if that makes any sense. But as far as anesthesia moonlighting, no.
Perfect. Dr. Carter?
I think at a doctor's hospital, typically you are allowed to moonlight. I don't know many people that kind of moonlight as a resident, however. But additionally with COVID, I think that's been suspended for right now.
You're a CA1, so you haven't been over to Nationwide Children's, but
I'm
you're
just here too. I'm just wrapping up, so I've been to Nationwide.
Oh, you are? When I was there, they allowed us to take extra call shifts there paid. Is that still a policy?
They did mention it. However, since the last time I've been there, they kind of switched up how they do their call schedule. So I'm not 100% sure on that, but I know that was an opportunity that was allowed.
Okay.
Yeah.
So there may or may not be opportunities. George?
For moonlighting, basically, during COVID, they changed it so you were only allowed to moonlight at Ohio Health facilities. But typically prior to that, you could moonlight, wherever you wanted to. And so you could moonlight at Nationwide Children's to do some anesthesia shifts there. They probably reduced the amount of shifts because basically the residents, when you used to take call there, would like cover the pain service at night. And now they've gone to like just an all PA model, I guess, for the pain service. So the residents really aren't involved with that anymore. But I still think you can do moonlighting there, but you probably have to wait till, Ohio Health clears everything in regard to COVID. But you could still moonlight other Ohio Health facilities like urgent care, ER, things like that, I guess, if you wanted to, probably as a CA2, but definitely as a CA3 you can.
Okay.
So,
Just a quick question. As far as any of the panelists are aware, is the plan to have audition rotations starting off, for this MS3 class going into MS4, or is it still kind of wishy-washy?
We are planning to, but I believe it's only for like our core students within Ohio University, like OU-COM, that are located like right here in Columbus as of right now.
Okay. Dr. Hamill and Dr. Elder, are you guys aware?
For us, we do offer like outside, for like MS4. We do have, those, the ability to audition people outside. In terms of 3 to 4, I'm pretty sure it's just the core students for the school that is sponsored by our institution. So I'm not exactly sure about that, though, to be honest with you.
Yeah, that's a tough question on my end as well. I know last year we let MS4s come that were part of our core, but I think GME is still trying to figure out what they're trying to allow as far as the year comes up.
Okay. So it sounds like to be continued. So Dr. Elder, Saif has a question specifically regarding the learning experience you have as a resident. Any correspondence with fellows? Do you get to work with them during your residency at all? And then attending to resident ratio is another question. I think that probably means how many attendings are at your facility versus residents, as opposed to 2 to 1 is my guess.
Yeah. Okay. So at South Point, which is our main hospital here that we're at, there are no fellows. So you get to do pretty much everything from acute to chronic pain. You're the only one. Now, I know when you go down to main campus, when you're doing your cardiac rotation, there are fellows there, and you will be with a fellow. Your CA2 year, but a CA3 year, I believe you're not with the fellow. So our interaction with fellows, you don't really see it that much. Attending to resident ratio, that's one reason I really liked our program is we have attendings that are always here. So like we have our core faculty, and then we have some that rotate through just from the whole Cleveland Clinic system. They can be from main campus or one of the other regional hospitals. So I think you're trying to ask, is it a good ratio? Yeah, I enjoy it. I enjoy the attendings we have. And if you need to know anything else, just let me know.
Perfect. Either of the other facilities, Dr. Carter, Dr. Hamill, do you guys have any direct influence or direct conversation with fellows? Do you get to work with them at all, or do you never see any of them?
I'll go first. Sorry, we don't have any fellows at our facility. Like I kind of mentioned earlier, UPM Solitis, we're a really small community hospital, so we do not have any fellows in our institution that we interact with. It's just us and the attendings. However, when we do go up to Hershey, they do have, when you're on PEDS, they have a PEDS fellow. So you get to interact with them. You don't do cases with them unless they're doing, usually they do like PEDS heart cases. So you can't interact with them if you're in that room specifically. But otherwise, we don't really interact with any fellows. The cases are pretty much all yours. In terms of attending to resident ratio, our core faculty here at Lititz, I guesstimate there's 9-10 attendings that we have pretty regularly. And then we have, like I mentioned, we have 8 residents, but on service at any given time, we only have like 3 to 4. So you can do the math there. The ratio is pretty good attending to resident ratio. So.
Dr. Carter?
Yeah, so I guess kind of a similar experience. We don't have fellows or anesthesia fellows at Doctor's Hospital. We do get to interact with them over at Nationwide every so often, specifically doing blocks and maybe sometimes in like an ENT room if you're splitting the room with them. But yeah, not terribly too many fellows. In terms of faculty, I'll defer to Dr. McKean on this question.
Yeah, I mean, I guess we're kind of going through somewhat of a transition here with our attendings. We've had several retire over the past year or so, and then 2 more who will be retiring. Thankfully, we're hiring we've already had some new startup and some more who are going to be hiring on board as well in the near future. So we're kind of going through a transition right now, but we'll have 8 total attendings. We have 7 right now. We'll have a total of 8. That's our goal, to have 8 total attendings. And then, we have 6 residents and 2 interns. So kind of you can see the ratio there. But yeah, usually on a normal day, it's 2 residents to 1 attending, 1 attending's covering 2 residents in the OR. That's kind of the ratio with that. But yeah, so that's our kind of transition. We also have home critical care fellows that I think our residents kind of work with there in the ICU, and then during maybe some like bronch cases and things like that. But probably, yeah, for anesthesia, it's going to be Nationwide Children's where you can interact with some of the fellows. I think I was going to mention that before with the transplant question. I mean, you probably aren't going to be specifically put in a transplant room at Nationwide Children's, but if you ask to, they will work with you and allow you to work in with one of the fellows at Nationwide to do some transplant cases there. That's probably the only place we rotate at that's going to do big transplant cases. And then of course you can do, that was one of the questions somebody had asked previously, is you're allowed to do away rotations if you'd like to, and specifically go somewhere where they do transplants to get that experience. Actually my co-resident back a few years back, she went and did a out rotation at Stanford, and got to do some pretty good cases out there and things like that. So yeah.
Well, fantastic. I think we have reached our time. We want to be gracious to the panelists who took out their day to come and talk with all of us. We will be doing more of these throughout so we can introduce people do the programs, and they can kind of ask some questions and maybe get some good guidance. One tip I would have to anybody that's doing an audition rotation is if you have a program that you really want to go to, don't do the first audition rotation there. You want to learn, and that way when you go to the rotation, you've already had a rotation, you know the drill, you can look like an all-star. Just if you have, a place that you really have to go to or really want to go to. Thanks everybody for coming. We will email this link out to people so that they can review it and watch it again, or send it to friends if they weren't able to come.
Great. Thank you, everyone. Thank you, Dr. Davenport, and thank you to all of our participating docs from the different programs. We appreciate everyone's time today. And this was recorded, so we'll email that link out to everyone, and follow AOCA on Facebook, Instagram, and LinkedIn to stay up to date on the different special student opportunities that we're going to be running through the rest of the year. So we will close out the Zoom, but thanks everyone again, and reach out to office@aocaonline.org with any questions. Thanks.
Thank you.